Hi everyone, welcome back to our channel Nursing K. Today we will discuss about the MCQ Day 2. Let's start. Which laboratory test is used to monitor heparin therapy? Option A PT, prothrombin time. Option B APTT, activated partial thromboplastin time. Option C INR. Option D bleeding time. The answer is option B. For the heparin therapy, we used only the APTT, activated partial thromboplastin time, because heparin prolongs the APTT. The normal therapeutic range is 1.5 to 2.5 times the normal value. PT-INR is used for the warfarin therapy. For the heparin, we used only the APTT. So the answer is option B. Next. Which electrolyte is the major intracellular caution? Option A sodium. Option B calcium. Option C potassium. Option D chloride. The answer is option C, potassium. Potassium is the chief intracellular caution, maintaining cell existability and acid-base balance. Next, what is the most common site of breast cancer? Option A upper inner quadrant. Option B upper outer quadrant. Option C lower inner quadrant. Option D lower outer quadrant. The answer is option B, upper outer quadrant. Most breast cancer, like this is in breast, upper outer quadrant. Upper outer quadrant is the most common site of breast cancer. Most breast cancer originate from the upper outer quadrant because of the high density of glandular tissue. In upper quadrant, there is the high density of glandular tissue. So the answer is option B, upper outer quadrant. Next, which heart valve prevents backflow of blood into the left ventricle? Option A mitral valve. Option B aortic valve. Option C pulmonary valve. Option D tricuspid valve. The answer is option B, aortic valve. The aortic valve closes during the diastole, preventing the black flow from the aorta into the left ventricle. So the answer is option B. Next, which vitamin deficiency causes the rickets in the children? Option A vitamin A. Option B vitamin B12. Option C vitamin D. Option D vitamin K. The answer is option C, vitamin D. Vitamin D deficiency leads to impair the calcium absorption, causing weak bones and deformities. So the answer is option C. Next, which pulse site is checked during infant's CPR? Option A radial. Option B brachial. Option C carotid. Option D femoral. Radial we used to check for the normal pulse rate. Brachial we used to check for the infant. Carotid for the adult, and femoral used for the child. So the answer is option B. For the infant we used the brachial. Next, which type of immunity is provided by vaccination? Option A natural passive. Option B natural active. Option C artificial active, option D artificial passive. The answer is option C artificial active. Vaccinations introduce the antigens that stimulates antibody production and memory cell formation is known as the artificial active immunity. So the answer is option C. Next, which of the following fluids is used for blood volume replacement in shock? Option A dextrose 5%, option B normal saline, option C Ringer's lactate, option D distilled water. The answer is option C Ringer's lactate. Ringer's lactate is isotonic, expands plasma volume and restores electrolyte balance in hypovolemic shock. So the answer is option C. Next, what is the drug of choice for anaphylactic shock? Option A atropine, option B epinephrine, option C dopamine, option D hydrocortisone. The answer is option B epinephrine. Epinephrine causes the bronchodilation and vasoconstriction reversing the anaphylactic symptoms rapidly. So the answer is option B. Next, which of the following is a sign of left-sided heart failure? Option A pedal edema, option B ascites, option C pulmonary congestion, option D jugular vein distension. The answer is option C pulmonary congestion. Left heart failure leads to pulmonary venous pressure increase, causing the dyspnea and lungs crackle. So the answer is option C pulmonary congestion. Next, which is the universal donor blood group? Option A O positive, option B O negative, option C AB positive, option D B negative. The answer is option B O negative. O negative blood lacks of A, B and Rh antigens. It's making it compatibility with the all blood types of transfusion. So the answer is option B. Next, which gland regulates body metabolism? Option A pituitary gland, option B thyroid gland, option C adrenaline gland, option D parathyroid gland. The answer is option B thyroid gland, because thyroid secreted T3 and T4 which controls controlling the metabolism, growth and energy utilization So the answer is option B. Next, which is the earliest sign of hypoxia? Option A cyanosis, option B restlessness, option C bradycardia, option D decreased urine output. The answer is option B restlessness, because restlessness and anxiety appear early due to brain sensitivity to low oxygen before the visible cyanosis. So the answer is option B. Next, which electrolyte imbalance causes the cardiac arrhythmia? Option A hypokalemia, option B hypernatremia, option C hypocalcemia, option D hypomagnesemia. The answer is option A hypokalemia, because low potassium interferes with the cardiac conduction, causing the arrhythmias, and ECG will show the U wave. So the answer is option A. Next, the normal range of hemoglobin for adult females is option A 8 to 10 gram per del, option B 10 to 12 gram per del, option C 12 to 16 gram per del, option D 16 to 18 gram per del. The answer is option C 12 to 16 gram per del, because hemoglobin level reflects the oxygen carrying capacity. Normal for females is 12 to 16 gram per del, and for males 13 to 17 gram per del. Next, which is the most important nursing action during blood transfusion? Is option A administer rapidly, option B warm the blood bag, option C monitor for transfusion reaction, option D shake the blood bag frequently. The answer is option C monitor for the transfusion reaction, because nurse must observe for the fever, chills, dyspnea or the back pain indicating reaction and stop the transfusion immediately. So the answer is option C. Next, which lobe of the brain control the speech? Option A parietal, option B temporal, option C frontal, option D occipital. The answer is option C frontal, because Broca's area in the frontal lobe regulate speech production, and damage causes expressive aphasia. So the answer is option C in frontal lobe, Broca's area. Next, which is the clinical sign of hypocalcemia? Option A Trouser sign, option B Cullen sign, option C Babinski sign, option D Carney sign. The answer is option A Trouser sign, because carpal spasm induced by the BP curve inflation that indicates neuromuscular irritability due to hypocalcemia. So the answer is option A. Next, which part of the nephron is responsible for the filtration of blood? Option A loop of Henle, option B Bowman's capsule, option C collecting duct, option D distal convoluted tubule. The answer is option B Bowman's capsule, because Bowman's capsule surrounds the glomerulus where blood filtration occurs under the pressure. So the answer is option B. Next, which test is used to detect the HIV infection? Option A VDRL, option B ELISA, option C Widal test, option D Mantoux test. The answer is option B ELISA, because ELISA detects the HIV antibodies. Positive results are confirmed by the Western blot test. For the confirmation. So the answer is option B. Next, which disease is known as the white plague? Option A pneumonia, option B tuberculosis, option C leprosy, option D diphtheria. The answer is option B tuberculosis. TB was historically called as the white plague due to its chronic course and pallor in affected patient. Next, which organ produces the insulin? Option A, liver. Option B, pancreas. Option C, adrenal gland. Option D, thyroid. The answer is option B, pancreas, because beta cells of the pancreas, islets of Langerhans, secreted insulin to regulate blood glucose. Next, which vitamin prevents neural tube defects in pregnancy? Option A, vitamin B12. Option B, folic acid. Option C, vitamin C. Option D, vitamin D. The answer is option B, folic acid. Adequate folic acid before the conception and in early pregnancy prevents the neural tube defects like the spina bifida. So the answer is option B. Next, which microorganism causes the tetanus? Option A, Clostridium tetani. Option B, Clostridium perfringens. Option B, Staphylococcus aureus. Option D, Streptococcus pyogenes. The answer is option A, Clostridium tetani, because tetani produce a neurotoxin and affecting the motor neurons, causing the muscle rigidity and the spasm. Next, which artery is palpated to check pulse during CPR in adults? Option A, carotid. Option B, radial. Option C, femoral. Option D, brachial. The answer is option A. We already discussed for the adult we used the carotid pulse not check not more than 10 seconds, 5 to 10 seconds. After that we have to start the compression. Next, what is the normal value of fasting blood glucose? Option A, 50 to 90 mg per day. Option B, 70 to 110 mg per day. Option C, 120 to 160 mg per day. Option D, 180 to 220 mg per day. The answer is option B, 70 to 110 mg per day, because fasting blood glucose within 70 to 110 mg per day indicates normal glucose metabolism. Above the 126 mg per day indicates diabetes. So the answer is option B. Next, which of the following is a symptom of hypothermia? Option A, flushed skin. Option B, shivering and confusion. Option C, increased heart rate. Option D, sweating profusely. The answer is option B, shivering and confusion, because decreased body temperature leads to muscle shivering, bradycardia and alter mental status. Next, which part of the heart acts as the pacemaker? Option A, AV node. Option B, SA node. Option C, bundle of His. Option D, Purkinje fibers. The answer is option B, SA node. The sinoatrial node indicates electrical impulses that control the heart rhythm, known as the natural pacemaker. So the answer is option B. Next, which of the following is a water soluble vitamin? Option A, vitamin A. Option B, vitamin D. Option C, vitamin K. Option D, vitamin C. The answer is option D, vitamin C, because water soluble vitamin is B and C. So the answer is option D. Next, which position is the best for patient in a shock? Option A, supine with head elevated. Option B, Fowler's position, option C Trendelenburg, option D lithotomy. The answer is option C Trendelenburg, because Trendelenburg position improves the venous return and cardiac output in the patient with hypovolemic shock. So the answer is option C. Thank you everyone. If you are like the video, please like our video and subscribe our channel. Thank you everyone.